here in Ramsay. After the various presentations and the Q&A, we will be sending out a link so that you can book virtual one-to-one appointments with the different departments, so that you can have specific conversations regarding your practice. That will come following tonight's webinar. But we do encourage, if you do have any questions throughout the various presentations, please do just add them to the question and answer function at the top of your screen, and we will get to them at the end. Without any further ado, I think I will be handing over to Tash.
Thank you, Rosie. Hi, good evening. So yeah, I'm Tash Chittenden, Digital Marketing Manager for Ramsay. So predominantly looking after the national and local marketing strategies. And I guess the aim of my team is to make sure that when a patient is at the point of looking or needing treatment, they either already know about us or they find us through search online. So we're looking to really drive inquiries into the business, especially into the self-pay market. So tonight I'm going to go through how you can develop your online presence with Ramsay, in particular your online profile. So we're looking first at the Ramsay website. So this is really to showcase you as a consultant to potential patients. So we know that a lot of people start their online search online. And this is where you can have your dedicated hospital profile, which contains as much information as possible about you. So that patient has a real good understanding about your clinical interests, your professional memberships, academic background, and they can really read into your specialism and the treatments that you offer. So this is where we really need to make sure, especially in the clinical interest, that you're really showcasing everything you offer. So especially the treatments, and more importantly, I guess for this, is that it's in kind of layman's terms. So when someone's searching for something, they don't always know that specialty, that terminology. So we really want to put it in kind of the terms that they use, so that when they are searching, you come up in a result. We've had a look at some research recently, actually, that kind of gaps in profiles, especially the absence of a photo, can create uncertainty, and it actually can deter patients from choosing a particular consultant. So we really do advise that as much information in here as possible, especially an image, can really help that patient when deciding what consultant they want to look at. This also helps in Google, so as much information you can get in there as possible. Google will crawl our website and they'll pick out that key information. So not only are you showing from a Ramsay website point of view, when someone's on there, you're hopefully being picked up in Google as well for a more wider search. Just move on to the next. Thank you. So along with your profile, which is where kind of someone's searching and finds you, can read all about you, there are different ways that we can also showcase what you do. Whether, you know, some of this might be outside that kind of actual surgery, but it will really just make sure that there's other information that someone can find about you. So we have kind of a new section on the site, which is where you can actually give a bit more insight into yourself. So we're always happy to hear of kind of new surgery that you might be doing, or accreditations or events that you might be attending. We can obviously put that on the website and share that externally as well. So it just gives a bit more information around yourself. We also do quite a lot of work on blogs. So this is kind of more informative and educational content. So it's actually, you know, what are people searching for and what are they interested in, and how can you give that information to them? So that kind of gives that credibility and trust to this content, but it also provides that educational and informative piece rather than them just looking for a consultant. So we can guide on that as well. So we look at kind of what people are searching for in Google, what are the most things that people are looking at, and that guides that content. So again, we're not just putting content out there that no one is interested in. We know that they're looking for it, and then you can kind of put that authority and trust to that piece of content as well. We're always looking for people to review our Ramsay website. So the content on there, so we've got a lot of treatment pages on there, which we like to have reviewed. So again, that's something that you can help us with. And again, that's just giving that credibility and trust to that piece of information. And then one of the things that we're really focusing on at the moment are all around testimonials on case studies. So again, a piece of research that's come out from Finn is around that recommendations from friends or family, but also patient reviews online are nearly as influential. So these reviews are allowing other patients to see others' experiences. So that really does help when patients are thinking about a consultant to go and have their treatment with, that they can hear from other people. So we have a real mix of kind of patient reviews, testimonials, case studies, whether this is in video or written format. So we're always more than helpful if you can share, patients that that would be willing to do that. Then we're always happy to talk to them, write that case study up, whether it can then become a video format as well. We can also add kind of quotes and feedback that you've got personally to your profile. So that just makes your profile stand out a bit more as well, that you've got that feedback from patients. So there's a lot we can do in this area. And as always, if you've got patients that are willing to talk to us, then we're more than happy to get in contact and turn that into that case study. And it really is a powerful tool. More than us, saying this is the treatment we offer, to hear from someone else that's gone through that is probably the best thing that we can start to populate. And then we also do a lot of video. So this ties into the kind of case studies and profiles, but actually this is a lot more around how we can showcase your services. So, an introductory snippet around a minute long about you and your practice, it just builds that trust and confidence in potential patients. We can link that to your profile, so when someone's reading, they can then click it, watch the video of you, and they get a bit more insight into you. We also do some things around specific services. So if there's a specific clinic you do, we can do a video on that. And it just makes it a bit more engaging for someone on what that service is. It also helps in the removing that lack of uncertainty. So if someone can actually see the service that we offer and hear from yourself, it's just building that trust in us as a hospital, but also the consultant and your practice as well. This also feeds into Google video search results. So we're not just thinking about the content side of Google, but we're also thinking about the video, which is becoming a lot more popular. So there's a lot of things we can do, and there's some stuff that I will share after as well, around who to get in touch with and what we can do and examples. So I'll share that with Rosie, and we can share that in the document that's circulated after. Thank you very much, and I will hand over to Paul.
Thank you, Tash, and good evening all. So my name's Paul Hayward, and I'm the Head of Commercial Contracts here at Ramsay Healthcare UK. So I oversee the commercial team and all our relationships with the insurers, so the PMIs. And in this section, I'll talk briefly about that the commercial team here at Ramsay think can help you increase your referrals from the PMIs. So on the first slide, it will just summarize the three aspects or the three areas that I'll cover today. So first, I'll talk briefly on direct bookings. Second, as Tash talked about, the increased importance of profiling with the different insurers. And then finally, the networks and some of the networks that the insurers have introduced. So the first slide is around direct bookings. And just moving on to this part. So from both consultants, patients, etc., is what is direct booking. So in simple terms, direct bookings is when an insurer can make booking directly with us without the need to call. And how it works is basically over the past few years, we've been increasing the secure links we have set up with the key insurers. So if you share your diary with the NEC team, we have the ability now to share that with the key. And the insurer teams are speaking to their members. They'll be able to see your availability in their systems. And if you've got availability, then they'll be free to book that accordingly. So making it a real journey. The information that the insurers then share will then be passed across securely to the NEC and the hospital team so that you've got that information. And it's becoming really successful. So you'll see on the right-hand side, the top 5 insurers now all have direct bookings in place. So that's Bupa, AXA, Aviva, Vitality and Helix. We plan to, by the end of this year, so by the end of December, we plan to have all 6 of the top insurers on board. So discussions are taking place with that other insurer. And as the graph demonstrates below, we continue to see growth. So this is definitely with travel for the insurers. And in the first half of this year, so 2024, we've seen an increase of over 50% in bookings through this avenue. So as I said, it's definitely the direction of travel for the insurers. And as other members of the team will touch on later, sharing your availability will not only help us and you from a PMI perspective, but it'll also help in terms of self-pay. Moving over to the next section then, in terms of profiling, it's becoming increasingly important, as Tash mentioned, that profiling, and certainly with the key insurers, the key insurers are using different systems to direct their patients. So we, the commercial team, think it's important that you're keeping your profiles up to date and relevant on all the key systems to make sure you're maximizing that opportunity of referral. And there's 3 systems that I want to bring to your attention. And the first is Bupa Finder. So you can go on Google Bupa Finder, and it will appear quite high on that algorithm return. It appears as it does on the right hand side there. So that's a screenshot from the Bupa Finder system. And we believe that it's quite a popular system. So not only Bupa advisors use that, but various different people across the industry use Bupa Finder. So it's a really important system to make sure that you're profiling really well on. Bupa tend to guide their patients to the consultants who appear at the top of Bupa Finder and at the top of their algorithm. So it's really important, if you want to see an increase in Bupa referrals, you try to make sure that you're ticking all the relevant boxes for Bupa. So being fee assured, being on their open referral network, and making sure that you're maximizing that profile appearance. The next system on the next page is Vitality Finder. So in a very similar fashion to Bupa, Vitality introduced their Vitality system a couple of years ago. Again, there's various ways you can improve your profile, but one of the big differences between the Bupa Finder system and the Vitality Finder system is that they display the direct booking functionality on their system, so patients, you're available, then linking back to that direct booking system and availability piece being key. The next system, and the final one just to bring to your attention, is Health Code's Private Practice Register. So this is also known within the industry as the PPR. So this initially was introduced to try and simplify the recognition process for new consultants. So AXA and Aviva and Vitality merged together in one application. So if you're new and you're not yet registered with the insurers, you can actually go on to the application, which will actually fire off to those 3 insurers. However, as time's progressed, AXA are now starting to use that information similar to various other systems and helping use that information to guide their patients to the relevant consultants. So 3 very similar systems, but really important from the 3 different insurers. And then finally, the last element which is growing is the number of PMI networks and towards these. So over a few years, we've seen a number of networks the insurers have increased, and it's really important that you as a consultant are actually listed on these networks. So I won't go into the but just want to this to your attention, and this slide gives you a bit of an overview of the top insurers and the different networks that they now have, and you as a consultant do need to be listed on that network to receive referrals from that insurer. So if you're unsure whether you're included or not, please reach out to your local team, your local private patient manager, who should be able to advise you. So that's the end of this section. So thank you for listening. I'm going to pass over to Sophie and the NEC team now. Thank you.
Thanks, Paul. Good evening, everybody. So I'm Sophie McCartan. I'm the head of customer experience for Ramsay UK. So kind of my remit is looking after the marketing teams, the front end NEC, kind of anything that's kind of encouraging the growth of the self-pay and PMI into our business. So I'm also joined by a couple of colleagues tonight who are going to take you through a couple of slides from the team, but I'll let them introduce themselves. So can I just go on to the next slide, please, Ellie? Thank you. So this is a bit wordy, but I'm going to talk you through it anyway. So I just guess the first point was just to tell you a little bit about the National Inquiry Centre, because I know that travelling around the country, some consultants don't really know what we are and what we do in terms of compared to what the hospitals do. So we are the central point of contact for self-funding patients. So when a patient phones through from a number that they've got from the website, they will get an option to choose one if they're a new self-pay patient, and that will come through to the NEC. But we also work on Paul and the commercial team's behalf with the PMI providers, getting outpatient appointments booked from them as well. So I'll talk through that in a second. So on average, we receive around 25,000 inquiries a month. And that will be through 3 different channels that I'll talk about, and we're booking just over 7,000 initial outpatient appointments per month. So it's quite a sizable operation. We're booking probably about 50% of all of the self-pay activity that comes into the business comes through the NEC. So we're based in 2 of our hospitals. So we've got a centre here in Springfield that I'm at the moment. And then we've got one in Woodthorpe in Nottingham. And we've also got a team of people who work from home, because obviously we've got limited space within the offices. And we have a partner that we work with based in Wrexham, who we partner with to help with our flex demand, so that if we get a really busy period or we've got a marketing campaign going on or anything like that, we can kind of ramp up and down our manpower accordingly to make sure that we capture all the calls that are coming in. So about 69% of what we do in the NEC is that self-funding piece. So that's about 69% of our inquiries. And patients up until very recently have contacted us either by phone or through sending a web form through the website. But we've also recently introduced that Ross is going to talk about in a little bit, so I won't steal his thunder, being able to book directly online through the website. So, and there's a couple of other things we're exploring there in terms of web chat and kind of some more, really good AI stuff that we could look at in the future to be able to deal with some of that stuff. 31% of what we do comes from our private medical insurers. So we are dealing directly with the PMI rather than the patient. So we have a referral management team that takes calls from all of the main insurers, but also deals with what Paul was talking about in terms of the direct booking. So as the insurers are booking that directly onto our system through your availability, we're just doing all the checks on that to make sure that it's all okay and it's going through. So we're kind of a bit of a sense check from a Ramsay point of view. So how we work, because obviously we're covering every single one of the 34 different hospitals, is we've got a spreadsheet of data that holds information about all of the hospitals, all the consultants that are there, and that includes things like your specialties, pricing, the length of your outpatient appointment, all like kind of different stuff that Sarah will talk you through, and a bit of the spreadsheet. And then what we do is take that information and use that to book appointments directly into Maxims. And then the other thing that we do a lot of is working really closely with the teams on site and the rest of this kind of customer leadership team that's on the call at the moment to kind of align everything that we're doing. So if there's marketing going on, we'll be prepared for those calls coming through, etc., etc. And then we'll feed back through that channel as well to make sure that we're maximising every opportunity that we get. And we do follow up on anything that we don't convert straight away. So unless it's an outright no from the customer, if it's not converted today, we have a follow-up process to go back to those and make sure that, you know, that we're maximising every opportunity. So I'm going to hand over to Carl to take you through the next slide.
Thanks, Sophie. Good evening, everyone. My name's Carl Burrows. I'm the Focus Planning Manager for the NEC. It's my job to talk to you about maximising the private referrals. So the NEC are looking at this from 3 different objectives. The first being quality performance. And for me, this is one of our key objectives, bread and butter for the NEC, really. So focus on conversions, i.e. the sales through quality customer service. Now, this strategy, it involves using those customer interactions that we receive, be it calls, emails and web forms, to not only resolve their initial requests, but also to create sales opportunity through really good, knowledgeable, insightful conversations and that personalised service people expect when they're using private healthcare. And by having that quality interaction, we're looking to build a rapport with that customer, build confidence in our ability to meet their needs, basically. And ultimately, it's all about securing that opportunity for you guys, and that's the end game for us. The next part is about quality monitoring process and the improvement through training. Now, Ramsay's shown a lot of faith in the NEC, certainly over the last few years, investing in the staff and resource. But it's also the training as well. Now, our team leaders have recently been through quite an extensive training program with an external company. And due to the success of that, we're just about to embark on a training program, or we've actually started for all our advisors. So if we secure the funding for all the advisors to attend, it's a 3-week program. All the advisors are attending, and we've invested that time and effort for them. It's about working on interpersonal skills, the conversational skills that's needed to quickly build that relationship with our customers. And this training is to help build that staff's confidence in having those quality conversations. And hopefully it'll help with delivering more sales opportunities through that really good quality service that we're offering our customers. The next part is about quality monitoring process, and this is another key element. The senior leadership team is made up of myself, the planning manager. We've got Charlotte, our customer contact centre manager, and then there's Natalie, who's our quality assurance and training manager. And I guess this is more evidence of the importance Sophie's placed on this element within our role, the quality that we deliver. We've put in place our own dedicated quality monitoring advisor, and it's their job to listen to all the calls between the advisor and the customers and assess that quality of that engagement or interaction if it's an email, for instance. We're evaluating all the agents' performance using scorecards, so it's a consistent approach that's measurable. And that QMA will then review the advisor's adherence to things like processes and routines, the accuracy of the information that they're providing, so the consultant's information, your information, which we'll cover off later on in this pack, as well as the soft skills. So this is about the professionalism and the empathy that they're displaying with that customer. We're also ensuring that we're compliant and there's no potential GDPR concerns or issues. And all this is reviewed and then fed back to the advisor and the team manager. They get 2 reviews every month, providing feedback, constructive feedback, picking up on the strengths of what they've done well, as well as areas for improvement. And then the manager can enforce those really good behaviours that they're displaying and decide on any one-to-one training, coaching, or any needs for the improvement as well. The final one is the flexible resource supporting seasonal peaks. Sophie's already talked about this. Demand in the NEC is never flat. As a small contact centre, we can't really flex our staff volumes quickly because all our full-time and part-time staff are on fixed or rotational shift patterns. We don't have any bank staff or zero contract advisors. So we've got this partnership with the outsourced provider, Moneypenny and Wrexham, and they give us the ability to quickly ramp up and down the number of staff needed to deal with the customer demand. So we see a surge of demand at the start of the year. It peters out during the middle of the year, and then over summer periods when the holidays occur, demand drops off and it picks up again. So it's like a wave throughout the year. And they allow us to have the right workforce with the right skills at the right time to allow us to deliver that quality service we just spoke about. The next one is reducing customer effort. This is all about the technology that we're deploying to improve customer experience. Basically, it's offering more channels of choice. Obvious example here would be the DFD, the self-pay portal, which Ross will give you more detail on later. And then the other one is the web chat function. It's a digital era. People are looking to utilise digital channels more through digital mobile devices. And we're hoping to deploy this sort of solution probably in Q1, Q2 next year. That'll be great for us because it'll deflect a lot of the noise calls that we receive at the contact centre, so that the guys on the NEC shop floor will be able to spend more time and capacity handling quality leads and securing bookings for you guys. And then the last focus for the NEC is all about growth. So each month our team leaders meet with PPMs from the different regions. We've got 6 regions around the country. We've got 6 team leaders, so they've all got 1 each. And they build relationships with those guys. And they're there to discuss any pressing matters that could impact our ability to book appointments. And the obvious one would be availability. So if we're getting constant requests for a procedure at a particular hospital, then we can talk to that PPM and ask them to look offer more slots or availability for that particular issue. And then there's these private practice events, these type of events which allow us to showcase what the NEC can offer you to secure opportunities and bookings. So those are our 3 main focuses. Sophie talked about some of the key numbers at month level, but we can see some at year level here. There's a few here I'm quite proud about. We've answered almost 250,000 calls last year as a contact centre, with an average wait time of less than 60 seconds, and an answer rate of almost 95%, and that's improving constantly through all the training and investment we're doing. Of that 250,000 calls, not all of them are opportunities. We do answer overflow calls and general queries. There's lots of noise that come into contact centre, but we have secured 135,000 inquiry handled, and 60% of those 82,000 inquiries have converted into outpatient appointment bookings. So I'm really proud of that. That's my slide done. I'm going to pass over to Sarah now, one of our TLs.
Hello everyone, I'm Sarah. I'm one of the Senior Inquiry Advisors, or aka a team lead in the NEC, and I'm based out of the Springfield Hospital. So I'm just going to talk you through a little bit about our spreadsheet database that we have, and just kind of explain what you can do to help you maximise referrals. So as you can see at the top, it's a little snippet of the database that we use. Our data analyst Christina fills this out regularly. It's an ever-evolving spreadsheet, but the main kind of key points you can see on here is that we hold information about core information, titles, full names, GMC numbers, specialities, and some of the key information that we really focus on is kind of keywords, specialities, and things that maybe aren't offered. Just kind of makes our patient journey a lot smoother, so that we can kind of offer exact information so that they know who the best person is for them to book with. And it also helps consultants as well, because it means that we're ensuring the patients that are coming to see you are the right people for you. And also it has, you can see on here as well, self-pay consultation fees, consultation times. So it's essentially a full rundown that explains kind of start to finish how long a consultation is needed for, pricing that we can give to a patient in that initial stage, and kind of any little extras or any kind of notes or important information that they need to know prior to that appointment, including referrals, possibly any kind of tests, that kind of thing as well. So that's what we hold for every single consultant that joins Ramsay. It's constantly being updated. So for example, if there's a price change or there's a amendment to the time required for an appointment, or if you take on a new speciality, then that can be added on. So that's something that we are always trying to make sure is fully up to date. But just looking at the information that we need from you, so the first thing would be first contact resolution. So access to live diaries is super important for our team in the NEC. Being able to offer availability and book appointments there and then is extremely helpful. It just means that we can resolve that patient inquiry really quickly, and also it means that in turn it's maximised referrals because we can get them booked in straight away. As Paul mentioned, to show up on the direct booking portal, live clinics is required, and as some people have already said, Ross will be talking about DFD. We do also need the live booking option for that to appear for you as well. So again, really helpful to have live inquiries, live bookings, because that just means that we can get those bookings made a lot quicker and a lot easier. We do categorise our database to kind of show who has these live clinics, or if people are maybe seeking more referrals, if they may be possibly new to Ramsay, and we can adjust these to kind of show people who are looking to take more appointments if you've got lots of availability. So we just kindly ask that, you know, if you're liaising with your private patient team on site, they can then let us know, and we can then update this to kind of explain, you know, push for this consultant, they're brand new, they really want to take on some new patients, or maybe if they're now looking to go live after not being live before, then we can then get that updated for you. That leads on to availability. So availability within the first 2 weeks is really key to ensuring more appointments get booked. We want to secure an appointment for you, but also for our patients before our competitors manage to. And for our key insurance companies as well, that we've gone over a little bit earlier, they do obviously refer a lot of patients into us. So good availability also ensures that they choose Ramsay. And the final little section, the speciality and pricing information. So as I just mentioned a little bit earlier, if you do take on new specialities or you update your consultation pricing, please again just liaise with your private patient team at site. It just means that this gets passed on super quickly. And as I mentioned earlier again, Christina, our lovely data analyst who works with Carl, she then makes sure that all that information is up to date so that we can provide really accurate information to our patients. It just makes their journey with us really transparent, secures their trust in doing business with Ramsay, and we hope that obviously the next time that they're in need, they will come back to us and to you. Obviously, if anyone has any questions about this section, then please feel free to pop them on the chat for the Q&A, because I'm happy to go over anything that's needed. But I will pass on to the next person as well.
Okay, thank you, Sarah. Yeah, hi everyone. Ross Finch, I'm the head of digital growth for Ramsay. And the main remit of my role is to try and look at new digital products that we can bring forth to our patients. Try and make things a little bit slicker. Try and give them what they want. We certainly sort of research and try and find out what our patients want. We've put together a bit of a sort of roadmap on some of the things they've asked for, to try and, you know, sort of make their lives a little bit easier, and make sure that we're keeping at the forefront of the technology that's coming out to us. So in terms of one of those projects, it's Digital Front Door, and this is about trying to get services as easy as possible to our patients. So if we go to the next slide, this is, I'll just briefly talk around the roadmap and why this has been chosen, but there's three specific phases. The first one is particularly around growth. So we found from the research patients were saying, you know, wouldn't it be great if I could have booked that appointment online? It would be great if I could have found out, you know, costs in advance, those types of things. And that was really important to them. You know, we found that a lot of patients were saying, you know, they weren't always aware of costs and felt that sometimes private healthcare was out of their reach. Whereas sometimes that doesn't have to be the case. There's different ways, you know, finance packages and so forth that can make it affordable for people. So one of the things was really bring that to the forefront, that actually it can be accessible to everyone to a degree. So the first iteration of our digital front door was very much focusing on being able to book an appointment, being able to look at more pricing and have more transparency around pricing, and this idea around being able to see what comes next in the journey. So, you know, do I need to have a consultation first, and I might need to go on some diagnostics, then I might go on to treatment after that, but being really clear what's going to happen next in the patient journey. And that's something they felt they weren't always sure what would be coming next, which can lead to some, you know, anxiety and so forth. So we've definitely focused on that first part, and we delivered that you know, probably about 8 weeks ago now. So we're still letting that bed in and improving it as we go, and we'll take a look at some screenshots in a second. Before moving on to some future phases, as we are successful with each of these, we move on to the next. So the core phase is more around sort of how can we improve the experience for the patient. So things like portals, where people can be more interactive with them, ask questions, maybe check symptoms, and you know, get some, you know, possible referral pathways from that. Virtual GP services, something that we've never done in the past. So the ability to sort of get more into the primary care element of that as well as concierge services. Now that's a little bit more further away, but starting to look at, can we give different options for patients? So via the portal, would they want to choose, you know, some different services on top of their self-pay package, and giving people choice? So we're going to take a look at that as well. Before moving on to what we class as our North Star, and this is very much around new ways of working, you know, whether that's a subscription based model of care, whether that's virtual care, or adopting wellness partners where we can actually offer new services over and above what we do already. But you know, that's in the future. We're very much focused on around the appointments, you know, having a portal and letting people see the costs to start off with. So we're not going to get carried away. We're going to make sure these services are successful before we move on to the next stages after that. So in terms of the next slide, the appointment manager, this went live around 8 weeks ago, and you know, you can take a look at different consultants on the portal, and you can see the availability they've got, and patients can book directly into those. One of the beauties of this is it isn't duplicated work. So all of the great advice that Tash gave in terms of adding keywords to profiles and adding photographs, that will all pull through to this digital front door as well. So you haven't got to do it twice. You know, if you submit that information with a photograph and the keywords that you want to have under your clinical interests, that will power this online booking as well. So that's really good. The other thing as well is, as Sophie, Carl and Sarah were saying, is that you have to have the actual live clinics available in the first place. You do need to share your diary to be able to come on to this booking portal. But yeah, the more keywords you can include in your clinical interests, you will get found via the search that we've got on there at the moment. Next slide, just briefly talk around, we were saying around the costs. So just trying to bring a little bit more to the forefront, what it might cost someone for a consultation, and then equally what might cost somebody for a treatment package in a particular area. And again, that was something that people really felt that they didn't always have the right information, or they didn't have access to that information, and as such felt private healthcare wasn't for them. It wasn't accessible to them, and they couldn't afford it. Whereas we're trying to dispel that myth, and we think that is a great piece of education for the patient. So, this is fairly generic to start off with. There are around 600 costs in the cost element of the digital front door. We will continue to build on that, as well as trying to look at diagnostic costs as well. Really give patients a real, good information about what it might cost them on their journey. And then lastly was around the whole thing on the next slide is around the treatment journey tracker. So again, giving people a real feel for what's coming next, what might be the time scales in between that. Again, just to reduce that anxiety. Look, this is the pathway you're going on. This is what you can expect, and be really clear about that up front. So there's no surprises. This is in its basics form. It's in sort of minimal viable product at this stage, but it's something that we really want to build on. And that's the next iteration of that is going to come in the next couple of months, where this becomes a full blown portal where people will be able to log in. They will be able to look at their past appointments for self-pay, book new appointments for self-pay. They'll be able to complete forms, so registration forms and so forth, and then we can see where we take it after that. There's loads of options that you can do with portals these days. Like we said, ability that might be video advice, digital information rather than paper leaflets, pick up information via the portal, post surgery exercises. I always know when I get those, it's you get it on a piece of paper, and I've lost it within 5 minutes. But being able to pick up exercises from the portal and keep on track with those, I think is a really beneficial thing for patients as well. So on the next slide, really the sort of second phase of our first part of the journey really is to build on what we've produced already, but as I said, introduce this portal capability where, as you can see here, someone can log in, they can update their details, they can see what appointments are coming up, whether they need to complete a registration form or a health questionnaire, and become more of a one-stop shop where this information can be added. So